New Brunswick, 2028. This is the year that will decide whether New Brunswickers want real health care or whether they are okay with their fellow citizens dying. The reality today is far from what it should or could be. This is New Brunswick healthcare. When you get sick, you expect help to be there when you need it. So you go to the emergency room, trusting the system will take care of you. But instead of care, you're met with uncertainty and long delays. Patients are now waiting 10 hours or more just to be seen. In many cases, those waits stretch far beyond what anyone should accept. And when you finally get close to care, there may not even be a doctor available. You're left without answers, without timelines, and without reassurance. This isn't an isolated situation. It's happening across the province. For many people, this has become the new normal. But this crisis didn't appear overnight. It's the result of decisions made and not made over decades. Warnings were raised again and again by those inside and outside the system. Doctors began leaving for better conditions elsewhere. Nurses faced increasing pressure, leading to burnout and exhaustion. Services were reduced, especially in rural communities. Reports were commissioned to study the problems. But too often, those reports led to little or no real action. Governments came and went, each promising change. But the system itself remained largely the same. Today, tens of thousands of New Brunswickers don't have access to a family doctor. As a result, emergency rooms are carrying a burden they were never designed to handle. Patients are often redirected, delayed, or left waiting without clear answers. For many, the only option is to wait and hope their condition doesn't get worse. And in some cases, the outcome is far more serious than it should be. This is no longer a system simply under pressure. It is a system that is failing to meet basic expectations of care. If nothing changes, the situation will continue to decline. People will keep dying. You join healthcare advocacy groups. You write letters to your MLA. You vote for the party that tells you they will fix healthcare. Nothing changes. More money is being spent with less and less results. We're all running out of time. How many more people have to die needlessly? Fixing this system will require more than small adjustments. But it would require real change that comes from personal commitment. So, what does create change? Pressure? We all need to speak as one to get our voices heard. No more accepting second-rate healthcare in New Brunswick. We must demand accountability and accept no excuses. But what if we had a bigger and better idea? Something that could help guarantee our healthcare improvement demands are met. Our healthcare shouldn't depend on luck. New Brunswick deserves better. Performance must be measured, and it must be transparent. Leadership should be accountable for the results they produce. That means investing in long-term care and community-based support. To invest in long-term care, these solutions are not theoretical. They are already being used in other systems with better results. It's already working elsewhere. It's the willingness to act. If nothing changes, the system will continue to decline. And the consequences will be felt by everyone. If we stay silent, we will have this conversation over and over. It means accepting a system that delivers less when it's needed most. We have the ability to change direction. But it requires people to speak up and demand better. What if we ran the provincial agenda? What if we were the politicians? No secret agendas, no backroom deals, and no glossy presentations. Just good old common sense from a grassroots level. Healthcare First NB will be running candidates in the 2028 election. While we will have a strong focus on healthcare, our platform covers all the issues facing New Brunswickers. Finally, make your vote count. Follow us on Facebook and on our website.